Dr. Alejandro Padilla has a burning desire to democratize access to the best-in-class healthcare, building a new business model that fundamentally changes how people and patients access orthopedic care. So he's a private physician, you know, very accomplished upper extremity physician. He does a lot of medical mission work for the indigent. He was in Ghana on a medical mission. Other times it's parts of Asia or Latin America. And then there are a lot of other ways in which he delivers his care. Another one of them, which I'm personally involved in, is OrthoNow, which is an orthopedic urgent care center intended to get patients with orthopedic injuries treated quicker and correctly at their first doctor visit, instead of the sort of circuitous route that patients have to go through now. Common theme is this desire to deliver best-in-class care in a way that is not dependent on somebody's ability to access it.
And I have the honor to nominate Dr. Juan Rivera, a Miami cardiologist and a specialist in preventing care. And he has been extremely successful with me and many other patients. His approach has avoided major heart surgery when other doctors and surgeons were saying you need open heart surgery. He has a passion for healing. He reaches out to hundreds of thousands of the Hispanic community specifically through his books, the different TV shows. He just wrote a book calling Mejora tu Salud, de poquito a poco, improve your health a little bit at a time. He was a host of Strange Medicine, where he traveled to South America and many other countries looking at alternative cures and alternative medicines. He's been a prolific author of scientific articles in cardiovascular prevention. He was also appointed by the California Endowment to educate the Hispanic community in the Affordable Care Act. He has a passion to make people's life better.
Why I think Dr. Tooks is a healthcare hero. I mean, he started as a medical student and did a couple of research projects and found out Miami is 34 times more likely for these drug users to dispose of the dirty needles in the street versus a place like San Francisco, where in '84 they pioneered this needle exchange program. He got into residency at Jackson, which is a pretty demanding program. During his lunch period, rather than going to the cafeteria, he'd be walking around with a granola bar outside, walking down Overtown, picking up dirty needles. Every single week, he would drive up to Tallahassee during session and plead his case. And every single week for 4 years, he would come back not victorious. When it finally got passed after 5 years, the emotion was just overwhelming, knowing what a difference he was going to make. So on World AIDS Day, December 1st, 2016, when the Idea Needle Exchange Clinic finally opened in the heart of Overtown, with the epicenter of the heroin epidemic, that to him was really his dream coming true.